the title of this talk is You Are More Important Than Your Lab Test. When you're talking about diagnosing a condition, in this case, we'll use hypothyroid or low thyroid function as the condition. If you want to diagnose that, many doctors, probably most doctors, look at the lab tests, and if the thyroid hormone is low or the thyroid-stimulating hormone is high, then they will call it low thyroid or hypothyroid, without talking too much about your condition or what's going on with you. So when we measure thyroid hormones, typical good pattern would be to measure 3 thyroid hormones. Thyroxine, which is T4, and the thyroxine goes out into the bloodstream and loses one of the 4 iodines and becomes T3. And T3 is a fast-acting and very active hormone. And it goes into the cell, and it takes the oxygen and the carbohydrate and sparks them like the spark plug in your cylinder in your car. That takes gasoline and oxygen and sparks that, and that creates a kind of a gentle explosion, and that drives the piston in your engine. And just as the thyroid hormone, the T3, along with the carbohydrate and oxygen, produces energy for your body. There's also TSH, which comes from the pituitary gland, which is up here in the brain, right in the center. And the TSH stimulates the thyroid gland to produce T4, which then goes out into the system and becomes T3. And you can measure all of these hormones. You can measure the TSH, you can measure the T4, you can measure the T3. And presumably, when the T4 and the T3 is low, then you can say you have low thyroid. That's what the point I would make from this discussion. You can have perfectly normal levels of T4, T3, and TSH and have low thyroid function or high thyroid function, some sort of imbalance in the thyroid. That just means that our technology has not yet caught up with the kind of diseases that we have. And low thyroid function is a very common condition. And most people who have it have maybe what you would call subclinical. It doesn't show up on the test. It shows up in the function. So the message you can take home from this is that you can go to your doctor and say, can I have a therapeutic trial of thyroid? If you read up on these symptoms and see that what I'm saying is accurate for you, then go to your doctor and say, I would like a prescription for thyroid hormone, and I would like you to monitor me. But I hope this gives you an idea that you can do many things without an agreeing lab test. That lab test may not agree with your clinical picture. So see your doctor and do it.